For those of you who don't know me, I'm Lisa Whiteman of Whitehill Financial, and my business partner, David Drumhiller.
Yeah, David out here in Pullman, actually from the new office that will be announced here soon.
Wonderful. Thanks. And we are so thankful to have Anthony Cuccia from Cuccia Insurance with us today. Anthony is a Medicare and long-term care specialist, and I've had the pleasure of working with him, says David, in the past. We worked together for the last 15 years. I will turn it over to you, Anthony. Go ahead.
Okay. When we're through, there will be time for a Q&A. As we progress through the slide presentation, feel free to get your questions, I think, in the chat box or just jot them down. And with that, I'm just going to jump into the material. All right, so today's presentation goals, we're going to cover original Medicare, what Medicare covers in costs, what Medicare doesn't cover, and then the options for gaps in coverage. So those are the different health insurance plans that are available to you. And then Medicare Part D prescription drug coverage. There's been some great news in that arena over the last 2 years here. And so with respect to time, I'm just going to jump into the material here again. And the presentation goals, again, original Medicare, what Medicare covers in cost, what it doesn't cover, and then the options for gaps in coverage. Those are your health insurance options, and then prescription drug coverage, and then enrollment. And so I'm going to cover just 2 quick questions here, and then we'll jump into the main content. What is Medicare? Just simply put, it is a federal health insurance program, and it is funded by taxes while we are working. What Medicare is not, it's not a family health plan. It is not Social Security. It is not Medicaid. That is our state aid program. And Medicare is not free. And then who can get Medicare? You need to be a U.S. citizen, a legal resident, and you must meet one of the following requirements. You need to be 65 or older. If you are under 65 and have access to Medicare, it would be because of a qualifying disability or because of a diagnosis with end-stage renal disease or ALS. All right, bookmark in your mind, this is the foundation of Medicare. It has 4 parts to it now, so this is something you want to remember. I'm going to give you just a quick overview here, and then we're going to tackle each one of these more in depth. So Medicare A and B, that's hospital, inpatient, medical, outpatient. It is referred to as original Medicare. It was signed into law in 1965 by former Harry S. Truman and First Lady Bess Truman, and that's that couple to the right up there. 15 years later, Medicare adds Part C. And what I want you to remember about Part C is that this is a health insurance option created by Medicare with the private insurance industry. So again, this is a health insurance option that's available to you. And then about 20 years later, we added prescription drug coverage. All right, so let's take a closer look at these. Part A of Medicare is hospital inpatient. So anything that you can think of that you would be getting billed for is an inpatient hospital stay. That's what Medicare Part A is. And I've given some examples here: hospital room and meals, intensive care, any drugs or medical supplies used during that stay, any of your lab tests, imaging like MRI, operation, of course, skilled nursing services, blood transfusion, hospice care, part-time skilled care for homebound, and then rehabilitation services after a qualified inpatient stay. All right, so what is the coverage that we get from Medicare? And I just want to remind you, this is without any health insurance in place. This is just straight Medicare. So you can see to the left of the screen there, it says the first 60 days. In the center, it says Medicare pays. And then our obligation is to the right of the screen, you pay. And so you'll see with the first 60 days, there is a deductible of $1,716. But Medicare does a fantastic job of paying that first couple months. It's after a 60-day stay that we need to be more concerned. And so if we were in there beyond 60 days, it's about $15,000. Days 91 through 150, it doubles. We're now paying about $30,000 a month. And then after 150 days, Medicare is going to gracefully bow out. And then the bottom portion of the screen here has to do with normally after a stay in the hospital, we're going to have some sort of recovery period. And Medicare is going to cover the first 20 days, like in a rehab center, skilled nursing facility wing, maybe a nursing home, but they do a good job of about the first 3 weeks. After that, there's a $209.50 co-insurance. So about just over $6,000 a month we'll pay. And then after day 100, again, Medicare is going to gracefully bow out. And so if we were just to reduce this screen down, Medicare is saying, listen, you go to the hospital, we're going to do a great job for the first 60 days. You just have a deductible of $1,716. And then we'll give you about 3 weeks to recover from that situation. After that, things get very expensive. All right, so what do we pay for Part A? There's no premium to Part A. You are entitled to it if you paid into Social Security taxes for 40 quarters or 10 years. And so again, this is something you're entitled to because you've contributed to Social Security taxes. All right, so moving on to Part B. This is medical outpatient. So anything that you can think of that you would be billed for the most part as an outpatient for your medical, that's what Part B of Medicare is. And I've given some examples here again. So your doctor's visits with your primary care physician, any specialist that you're seeing, annual wellness, so preventative stuff like any vaccinations, your lab work, again, any imaging, MRI, CT scans. There are some health programs that are available, any of your therapy at the bottom of the screen. And then to the right, diabetes screening, mental health, durable medical equipment, and then ambulatory surgery centers. So this is referring to a day surgery. So if I needed some sort of day surgery, even a knee replacement, I'm to understand now can be done on a day surgery. And then ambulatory or ambulance and emergency, and then some skilled nursing care and home health aid services for the homebound. And what that's referring to is they could send somebody out if you had a knee surgery and they're going to change the bandage, check the wound, make sure everything's healing okay. This is not to be confused with just straight home health care. There's limited amounts of this. All right, so with Part B, there is a premium. And to the right there, you can see it's $206.50 starting in 2026. And then some of us, depending on our income bracket, we will pay more than that. So I just put this up there to the left. If you file individually, if you're filing jointly, you can see the difference there. So if you're making 107,000 to 134,000, you're going to jump up to the $261.70 for your Part B premium. And then filing jointly, it just doubles 214 to 268. And so you can figure out where you're at in this bracket, but this is what to expect for 2026. All right, so with Part B, there is a deductible. So where you pay just under the $206.50, it's $261.70. So assuming it's January 1, I go to the doctor, I'm going to pay that first $261.70. And then after that, we drop down to where it says Medicare approves amount, Medicare pays 80%, we pay 20. So now after I pay that deductible at $261.70, I'm now responsible with no cap for 20% of all of my medical expenses. And then there are cases where Medicare has some unapproved amounts. Below that is excess charges. I'm going to cover that in a little bit. And then this is just a recap screen of Part A and B of Medicare. In original Medicare, they don't cover all of our costs for care. You have out-of-pocket costs with no limits. We just covered that with deductible co-insurance amounts for Part A. Same with Part B. No cap on that 20%. Prescription drugs, routine dental, vision, and hearing is not covered by Medicare. Therefore, eyeglasses, contacts, and hearing aids are not covered. Medicare does cover cataracts. So I just wanted to clarify that. And then care received outside the US, excess charges, I'm going to talk about that in a minute. And then, of course, long-term care and custodial care. So Medicare does not cover long-term care. So if I needed extended home health care, or I needed to go to assisted living, or I end up in a nursing facility and it's beyond 90 days, Medicare does not pay for that. They were designed to pay for medical costs, inpatient hospital and outpatient medical. All right, and because there's these gaps in Medicare, that's why we need additional coverage. And to the right of the screen, you'll see I listed option 1 is Medicare Supplements, also referred to as Medigap insurance. Then there's option 2, which is Part C of Medicare. Those are the health insurance options created by Medicare with the private insurance industry. And then option 3 is some of you may have an employer group or retiree plan that you have as an option. So let's take a closer look at these. Medicare supplements are going to help pay for the out-of-pocket costs that come with original Medicare. There are 10 different plans. All 10 of these cost something different and they cover something different. And then this coverage is going to be standardized throughout the country with the exception of Massachusetts, Minnesota, and Wisconsin. So if I have, let's say, Plan G, and I go to California, Arizona, Idaho, Oregon, it's all standardized. My Plan G is the same in almost all states with the exception of those 3 I mentioned. And then with the Medicare supplement, you have the freedom to see any doctor who accepts original Medicare, and it's self-refer. All right, so to the left of the screen where it says benefits, those are all the gaps I've listed there in Medicare A and B that we would be responsible for. And then I highlighted Plan G because that's the most popular plan. And you can see as you run down that list where it just pays 100% until you get to the blank box. And that is the Part B deductible. So if I have Plan G, my only responsibility with that is going to be the Part B deductible at $261.70. And then just under that blank box to the left of the screen, you'll see where it says Part B excess charges 100%. I'm going to define that now. So if you go to a clinic, doctor's office, and they have a right to charge up to 15% more than Medicare's allowable charge for that procedure. If they choose to do that, Medicare puts a cap on it of 15%. They can't charge any more than that. But if they choose to do that, this plan picks up 100% of those excess charges. And so it's very comprehensive coverage. And then at the bottom there, 80% foreign travel emergency up to a plan limit. These plans generally cover about $50,000 worth of medical costs outside the US. All right, so if I wanted Plan G, it's going to run me about $250 per person. There is some discounts for couples, spouses, partners. So this plan is there could be a little pricey, but it's very comprehensive coverage. And then again, my only obligation under this plan is that one-time annual deductible of $261.70. So if I wanted a Medicare supplement, Plan G, Plan N, any of these, it would look like this. I need to have Part A. I need to have Part B of Medicare in place. Then I can purchase a Medicare supplement. And Medicare supplements do not have prescription drug coverage embedded in them. So we would have to add a separate drug plan to it. If you want dental, that's another plus sign. If you want vision and hearing, those are more plus signs. So Medicare supplements are in some ways pieced together, but good options, not for everybody, but a great option. All right, moving on to option number 2. In these other Medicare Advantage plans, most of the commercials and any information you get in your mailbox, if you're aging into Medicare right now, or about 6 months away from that, you feel like a celebrity every time you go out to that mailbox. And that is largely the advertisement with the Medicare Advantage plans. These plans work a little differently. So this is something else I would want you to bookmark. Not only is this an arrangement with Medicare, with the private insurance companies as a health insurance option, but these plans work a lot like employer coverage. So I want you to remember that. They're just like your employer coverage, there's little co-pays. If you go see a specialist, you may pay $45 to do that. There's also maximums. So there's a ceiling to how many co-pays or how much you contribute in a year, and then you would max out, hit a ceiling, and then after that, these plans would pay everything after that. Some of you have a $4,000 cap, the most you could pay in a given year. Some may have been, it may have been 6,000, but these plans are designed off that same platform as medical insurance through an employer. So just bookmark that. And here's how they work now. The federal government is going to pay one of these companies, Humana, Aetna, Regent, United Healthcare, WellCare, Kaiser, and the list goes on. They're going to pay them to offer you a medical plan. And most of us are familiar with the top 2. We know what a HMO is. It's more like a Kaiser, where there's a network of doctors only that you can go to. All of these other companies, they also have HMOs, just a network of doctors. Then underneath that is a PPO. That works more like if you had Regents, where there is a network of doctors, but if you decide to go outside that network, it's going to cost more to do it, but you have that option. And then I'm going to skip the private fee for service. They're just not popular, so I won't spend time on that. But there are special needs plans depending on what your income is, or if there's some sort of chronic illness. So those are referred to as special needs plans. And so again, these plans are going to cover all your medical with some co-pays, an annual maximum cap. But in addition to that, they're going to provide dental, vision, hearing, a wellness benefit, even a fitness membership like 24-hour fitness or Planet Fitness, maybe even the YMCA. You'll notice also under that it says prescription drug coverage Part D is included. So with these Medicare Advantage plans, they're just bundled together and they behave more like employer coverage. And then I'll draw your attention to the bottom of the screen. Medicare Advantage plans have an annual out-of-pocket maximum to help protect against high costs. So again, there's only so many co-pays you can pay in a given year. Then you hit that ceiling and the plan has to pay everything after that. All right, so what am I going to pay for one of these plans? You'll see where it says monthly premium is 0 and up. And what I mean by up is $25 a month, $35 a month. But for the most part, you are not going to pay a premium for these plans. They're all like just 0 premium. And so I'll stop here just for a minute. You might be thinking to yourself, Anthony, how can these companies offer me all my medical, add additional benefits like dental, vision, hearing, prescription, gym membership? How in the world can these companies do that and not charge me a premium? If we go back, I'm going to jump back here. Remember, the federal government is already paying these companies to offer you a medical plan. And these companies get enough money from Medicare, they don't even need to charge you and I a premium. Okay, so they're not free because nothing's free, but what they're doing is they're taking your tax money that you've already paid in to Medicare and they're just shifting it over to an insurance company. So essentially, Medicare is buying a health insurance plan for you with your tax dollars if you choose to sign up on one of these plans. So hopefully that's simplified enough to understand how that works and why there's zero premium. Underneath that, it'll say annual deductible health. There generally is no health deductible with this. Some of our medical plans, we would have to pay like the first $250 before the plan kicks in and starts to play. These plans don't work that way. There generally is no health insurance deductible. And then I'm going to cover the annual drug deductible, co-insurance amounts, and prescriptions in just a little bit. All right, option number 3, I won't spend a lot of time on this. It can be different for everybody, but you may have a retiree option like through FEHB, PEBB, or SEBB. You may have retired with Boeing or some other employer, and they have a Medicare health insurance option for you. And we want to look at those, but we also want to compare it to everything else that's out there. I will say this. There are no bad medical plans when you get onto Medicare. They don't exist. There's no such thing as a bad medical plan. There's just a lot of options and they're all different. A lot of the employer plans have premiums to them. Some of them are very high. But again, there is no bad option. It's more subjective. What do I want? What am I looking for? But what I would be able to help you with is if you have those options, is comparing them to what are the other options out there so that we can make an educated decision on our medical plan. All right, so moving on now to Part D, prescription drug coverage. I've simplified this. There's only a couple things you really need to know about this. It can get really confusing sometimes, but for 2026, there is a deductible of $615. So I'm obligated to pay the first $615 in prescription costs. I will say if you have a Medicare Advantage plan, a lot of these companies reduce that down to 400, maybe 300, that type of thing. So they discount it. After you pay the $615, you are now responsible for about 25% of your prescription costs until you reach $2,100. You've now capped out, and after that, it's considered more like the catastrophic phase. You don't pay anything for your meds. So this is really good news. Medicare implemented this back in 2025 was the first year for it, but in 2024, you could have paid up to $8,000 for prescriptions. In 2023, there wasn't even a cap. And so Medicare has made a lot of headway in this area, and this is good news for us that we have these caps for prescriptions. All right, so moving on to enrollment, I tried to simplify this also. So if you're aging into Medicare, you may be automatically enrolled if you were receiving Social Security income. Maybe you were on Medicare prior to this, but you could have been receiving a railroad retirement benefit. But Medicare automatically enrolls you if you're receiving Social Security income. And they're going to send you your red, white, and blue card about 3 months, 4 months before you age into Medicare. For most of us, we've delayed our Social Security income, and so we are going to have to self-enroll. And the way you do that is that, assuming you're going to turn 65 in the 4th month in April, you're going to sign up 3 months prior to your birth month. So you're going to do it in January. And so you're always going to want to do this prior to turning 65, and you want to do it 3 months before you turn 65. All right, so I'm going to give a couple examples here because some of you may continue to work with an employer, Do I sign up for Part A? Do I sign up for Part A and B? And I'm going to answer that question here with these two examples. All right, so there's Mary, who's going to leave employer coverage. She turned 65 in April. Assuming she didn't sign up for Social Security income, she's going to have to enroll in Part A and B of Medicare. And she's going to do that again 3 months before her birth month. So she'll do it in January. Once she signs up for that, we now can start shopping for health insurance plans. Then there's Bill. He also turned 65 in April, but he's going to continue working through his employer. He only needs to sign up on Medicare Part A. He's going to delay Part B for two reasons. One, there's a premium to it, so we don't want to start paying that premium of $206.50. We don't want to do that. But he also has credible coverage through his employer. So Medicare does not require you to sign up for Part B. You can delay it. Now, 2 years later, Bill's 67. He's decided he's had enough. He's ready to retire. It's at that time that we're going to add Part B. And you can do that 60 days prior to your retirement date. So it's important to nail down a retirement date, get a fixed retirement date before we decide to sign up for Part B. I've had some people where they're like, yep, I'm retiring in 2 months. They sign up for Part B and then they go, oh, you know what? I think I'm going to stay there another couple more months and work. We don't want to try to disenroll in Part B. It's just a mess. And so try to have a fixed retirement date before signing up for Part B. And then after we do that, we can shop for a health insurance plan. And then I'm going to put my information up here. I can take some questions here in a few minutes. What I want you to know is that as a Medicare broker, I have access to all these different plans that are out there. And the way we work this is that if you're interested in this, I'm going to send you a questionnaire that you're going to fill out. You're going to put on there your primary care physician, any specialist, your medication list, your dentist. And once I get that information back, I'm going to shop all the different plans that are out there. Whichever ones come in, usually the top 2 or 3, I put those in a spreadsheet. I email them over to you, and you just book an appointment with me right off the email. You can see my calendar, book an appointment, and then we review those health insurance options. Okay, so it's a streamlined, simple process. I'm going to do all the research, the shopping of the different plans. I'm going to know if doctors are in network. I'm going to know if your dentist is. We're going to know what your medication costs are, how they compare to other companies. It's all on the spreadsheet I send you, and it's very simple to review. And then if you have any questions at all, just you can call me direct. If I don't pick up, just leave a message. I'll reach out to you just as soon as I'm able, or you can email me at assurancenorthwest.com. And then at this point, we can open it up for questions.
Great. Anybody have any questions out there?
No questions, but I did want to thank you. It's great information. I'm still way too young to even start the process. But anyways, I try to pay as much attention, and even with my notes, it's, oh, this is helpful. This kind of keeps explaining it. As you start the whole retirement plan, just want to understand what you're going to do.
Yeah, yeah. And retiring can bring in a lot of pressure, anxiety, that type of thing. So having somebody to assist you to navigate this piece. So, it's uncharted water, and I'm absolutely happy to help at any time. Feel free to reach out. And then if you think of other questions, if you think of other questions as we end the webinar, just feel free to email me, call me. I can answer them then.
Anthony, can I have you touch a little bit on, just really quickly, I know it's not a super simple answer, but why those enrollment dates or knowing your enrollment date is so important?
Yeah, Medicare has strict guidelines that we have to follow. And so if we don't follow them, we can end up with a penalty. And it's not just a one and done penalty, it's a penalty for life. They don't take it away after 5 years or 7 years. You have that penalty for the life that you're on Medicare. So I would pay attention to that. The main thing is that if you have credible coverage through your employer, it has to be an employer group that's 20 employees or more. If it's less than 20 employees, then Medicare becomes primary. And you want to remember that. I would just say if you have any questions about when to enroll or how to, I can take care of that, walk you through it, and it's a simple process. But yeah, you want to make sure that you enroll when you're supposed to so that you can avoid the penalties.
Great, thank you. I appreciate you touching on that.
Yep.
Anything more from anybody? All right, we really appreciate you guys joining us. Thank you so much. Thank you, Anthony, for your time. It was really valuable information. Of course, if you have anything that you would like to address with David or I, our information is all up on our website at www.mywhitehill.com. Feel free to reach out, schedule an appointment. We're here to help. Thanks so much, everyone, and you all have a great day.
Thank you.
You.